If your doctor has ordered iron studies, they're looking to see if you have too little iron, iron deficiency, or too much iron, iron overload. As well as your iron level, two other substances are measured. These are involved in either transporting iron or storing it in the body. By looking at the levels of each of these in the context of the others, and taking into account your symptoms and medical history, your doctor can put together a picture of what's going on. So, let's take a look at a typical iron studies results form. First of all, iron. This is the amount of iron circulating in your blood serum. Blood serum is the liquid part of the blood that remains once all the blood cells have been removed. Iron testing uses blood serum rather than whole blood because serum is where these substances are dissolved. The serum iron level is usually low in iron deficiency, but it can also be low due to other causes, such as current infections. Serum iron is usually high if you have an iron overload, but it can also be high if you've recently eaten iron-rich foods, such as steak or liver. Serum iron is too variable for diagnosing iron disorders by itself. It needs to be used in conjunction with the other iron studies tests so a better assessment can be made. Next, transferrin. Transferrin is a protein that attaches to iron and transports it around the body in the bloodstream. Next, transferrin saturation. This is calculated from the iron and transferrin results. The number represents the amount of iron that has been attached to transferrin as a percentage of transferrin's total iron carrying capacity. It is a more accurate indicator of the amount of iron in the body than either serum iron or serum transferrin alone. If you have iron deficiency, transferrin saturation is likely to be low and high if you have iron overload. A higher transferrin saturation can be the earliest sign of the iron overload disease, hemochromatosis. Ferritin. This is another protein that attaches to iron. The amount of ferritin in the blood serum is the best measure of the amount of iron stored in the body, mainly in the liver. A low serum ferritin is almost always due to iron deficiency. However, ferritin levels can be misleading. If you have an inflammatory disease, especially liver inflammation, this can cause high ferritin levels, even if there is no iron overload. This means that someone with inflammation can appear to have apparently normal ferritin levels when they are actually iron deficient. The results of all these tests need to be considered as a group, along with the results of any other relevant tests you've had, such as a full blood count. They need to be assessed in the context of your whole medical history and your symptoms. You'll see that your iron studies results are compared against what are called reference intervals or reference ranges. These are a way of describing where most results will fall for the test. You may have results in your report that are flagged as being too high or too low. It's important to realise this is not something you need necessarily be alarmed about. They may not mean anything significant in your personal situation and need to be interpreted by your doctor. If you'd like more detail about iron studies, you can find it on the Lab Tests Online Australasia website, along with all the related tests and the many conditions they are used for.